Hey guys, welcome back to another episode of Lived and Told. Today I don't have one, I don't have two, but I have three guests on today. So to give you guys a bit of background around why they're here, when I started this podcast, I always had the idea of doing what today's episode is, a roundtable. So this episode will be, as you can tell by the description, around allied health here. So I've got here Lisa, Dan, and Christina here, and I probably won't do them justice, but maybe go around and give them a quick introduction of who you guys are, where you guys work.
I'm Christina. I'm an osteopath. I work at Alpha Sports Medicine, based out of Newport and Bacchus Marsh.
Let's go. My name's Dan. Hi, everyone. And I am a physiotherapist. I like to say I'm a part-time physio, full-time morale booster.
No janitor? No more janitor?
No janitor. I've upgraded myself.
Yeah, so
yes. Thank you. CEO of the prison.
Promotion.
I'm Lisa. I'm my therapist. I work here alongside Dan, and I work in elite sports teams as well.
Yeah. And Lisa was on episode 1 of the podcast. So if you haven't listened to that, pause it right now. Listen to episode 1 and come back to this one. But into the episode today. So I've got my three good friends on allied health, and the roundtable or the discussion today came from an idea was around, bringing up, quote unquote controversial topics. And disclaimer, these opinions don't represent their industries. They kind of represent their own opinions there. So I want to put that out as a disclaimer. I don't want them cancelled. I don't want you guys not seeing them at all. But let's get into it, guys. I prepared us 8 or 9 questions. We may or may not get through all of them. Maybe do a part 2, but as I said, it's around questions that I've had come up within myself or from other people that I've spoken to around allied health. So maybe we'll kick off. And for even further disclosure, I've given them only one of these questions. So the other 8, they don't know it's coming. So
There's 8?
There's 8.
Oh, jeez.
I'm
glad you
There's
brought dinner.
definitely going to be 2 parts.
I'm
Yeah.
glad you brought
scared.
snacks.
I'm so scared.
All right, we'll go with the first one.
Yeah, let's do it.
All right, the first one is...
Wait. Let's just pre-frame this. Whatever our opinions are, by the time we finish the podcast, we'll still be friends.
Okay, no
Yes.
fighting.
All right?
Of course.
Oh, I
No
thought you were doing
fighting.
paper,
No
scissors,
fighting.
rock.
No fighting.
Okay, no fighting.
There's nuggets.
No fighting,
We're all
guys.
friends.
No fighting, guys. All right. Ready?
Yes.
Yeah.
So the first question, and whoever wants to jump in can jump in first. I should probably say at the start, but whoever wants to jump in first. Should clinical experience outweigh research evidence?
Should clinical experience outweigh what?
Evidence.
Evidence, like
Evidence.
research?
Yeah.
Research.
Research,
Damn.
Oh.
Do you want to kick this off?
Go on.
In my opinion, I think clinical experience should outweigh research. Only because in textbook, like you learn everything in the books and everything's like, perfect, right? But then the person you see is always going to be different to the textbook. It's different variations of different pathologies, obviously. So everyone's different whenever they come in. So I think that's my reasoning behind why clinical experience should be more important than textbook. Even though textbook is really important, obviously, it's
Yes.
our foundation. But yeah, that's my opinion.
Yeah.
Go
No,
on.
you go.
I was going to say, if anything, research helps form the clinical setting, because you kind of have an idea of what should be happening, but everything's different once the person's in front of you.
Yeah.
It's like when you get a result from a scan and it says this, this, and this, but the person comes in and they're like, well, I don't have any of that. And you're like, cool, well, this is irrelevant.
Yeah.
Yeah.
So, yeah, I agree with Lisa.
And just to touch on a lot of the research papers, it's all done in a very clinical environment.
Yeah.
And everything's very, what's that word I'm looking for?
Ideal conditions.
Ideal
Yeah.
conditions, sterile.
Yeah.
Everything's very sterile. And a lot of the times it does not reflect what real life looks like.
Yeah.
And as Kripps touched on before, we're dealing with real people with real emotions and all these experiences through their life, whether that be trauma or happiness or whatever experience they might be going through. So I think, as you said, it does guide our treatment, but I think at the end of the day, we have to treat the person in front of us. Whether it outweighs it, I don't know.
Yeah.
I think this is a bit of a boring answer, but
Yeah.
I'm on the fence.
No, you gotta pick one.
Well, in that case, I
Is that
would.
your question? Yeah, just pick one.
Pick one, yeah. Obviously, it's your own opinion, like I said. And it's not right or wrong, obviously. But
I'm in the middle, but like if you had to pick one.
Yeah, same. Because I think actually helping the person in front of you is more important.
yeah, 100%.
Than what the
Yeah.
textbook says.
Yeah.
100%.
Okay, awesome. Sounds like we've got a uniform answer. So first one's Steve.
Still friends.
First one's
We're
Steve.
still friends.
All right.
Going strong.
Question number 2. This is probably the question that kickstarted my whole idea and concept of doing this episode.
Nice.
So, if I was Mark Butler, and for those who don't know, Mark Butler is the Health Minister of Australia. So if I was replacing him,
Probably should know that.
I know. I was like, who the hell are you talking?
if I was replacing
Elbow?
Albanese, or reporting to Albanese. Anyways, if I was replacing him for a week, a day, however long it was, one reform that I would change to allied health would be I would, if I'm underbash you guys, I would actually scrap most of your roles in terms of I would combine them together. And where this comes from is, if I were to go down the street and you all introduce yourselves to a random person, they'll be like, so what do you do? What do you do? What do you do? So I would simplify it, and I would probably, and if a current is here, I would include in the conversation too, kind of just get rid of all of you and then bring it back to one or two allied health professions that you cover different kind of fields where you cover off on everything as well. Is, I guess, the question of mine, do you guys agree with that? Or is my view too simplistic that, it's a bit more complicated than that?
Do I come first?
Yeah.
Interesting. Because I agree. I think there is a lot of
Yeah.
confusion as to what we do.
Yeah.
We've got an osteo, physio, we've got a myotherapist here as well. And I think the common misconception, they just look at our name and then go, oh, physio must be massage and exercise. And then osteo must be
You
something
fix bones.
something to do with bones.
Yeah.
And then myo, what's a
Just
common?
massage.
Just massage.
Just
Just
massage.
massage, yeah.
So they
Not even
kind of.
massage. I'm a masseuse.
I'm a masseuse.
Yeah.
I know that goes.
That goes like it.
So the argument is then is to simplify the whole process.
Yeah.
All three of you would be the one title and cover
Yeah.
off on all those different areas.
Yeah. But what would we be called?
Yeah.
I mean, that's for me to figure out. That's part 2
That's
of my
the next
plan.
dream.
Yeah.
That's part 2 of my phase.
I feel like
my
physios
plan.
don't get that much confusion. Like, everyone knows what physio
Everyone
is,
knows what
yeah?
physio is.
Because we've been
Yeah.
around since like
The
the
longest.
beginning of time.
Them and
Like,
Cairo.
we've
That's
treated
true.
Jesus before. We've
Yeah.
been around for so long.
Okay.
Shout-
Jesus
shout out-
created you.
Yeah.
But I feel like massage has been around for longer than that.
Yeah.
Massage
Yeah.
in general, just
Yeah.
massage.
Therapeutic massage. Yeah.
Yeah.
For sure.
Mm.
Because I'm not sure if you guys know, but physios were born out of nursing.
Oh?
In
Really?
the very
Really?
beginning.
I had no idea.
Yeah. So
Yeah.
the very first physios were actually nurses, and then that kind of branched off into. So the nurses were working in the wards doing what nurses do, and then they were getting people up, getting them moving post-op,
Oh.
and then that kind of branched off into physiotherapy. And this was like back in early, I don't
Yeah.
know, early 1800s.
But then there's EPs as
Yeah.
What's an EP?
Exercise physiologist.
Okay, so you're further into the mix as well.
Yeah,
so,
there's another
so I
one.
guess that's the thing. If you take a care plan, whoever's had a care plan,
Like
before
10 of
they
them.
changed it in July, you'd have a list of about 12 to 16 practitioners you could go see.
Yes.
All of them same, but
Similar.
still very different.
Mm.
Yeah.
Mm.
So even if you were to combine all of them, it'd be very hard to then split into one group and another group because you've got physios, osteos, chiros, exercise physiologists, podiatrists. So it kind of depends. But then you've also got dietitians, diabetes experts, myotherapists, remedial.
Yeah.
There's too many
It's too many.
to kind of simplify.
If there's 16, would you then simplify it to maybe like, excuse me, maybe 5, 8 between that number?
Yeah.
I keep podiatry because they're like obviously foot specialists.
Yeah.
And we can't be good at everything.
No.
Yeah.
And lower limb is so hard. It's so complex.
So much in the foot.
Yeah.
100%. Yeah.
Yeah.
So yeah, there's plenty you
Yeah.
could match up
Mm.
with others. Like you could put diabetes with the podiatrist
Yeah.
and
Yeah, okay.
physio with the EP and
Yeah.
osteo with chiro and remedial with myo.
Yeah.
But
Scrap the remedial, just keep my own.
yeah.
No massages.
So
You know what I mean?
that's what I mean.
Oh.
People get confused with
Yeah.
myo remedial,
Mm.
physio, chiro, Osteo,
EP Physio.
EP Physio.
Yeah.
There's already too many to confuse.
Yeah,
But,
and that's where the idea came from. That's where it
Yeah.
comes from. Yeah.
but they're all still so important
Yeah.
as their
For
own
sure.
separate
Yeah.
Like
what's
Gen
the word?
Pop.
Commodity. Yeah.
Gen Pop doesn't know
The difference.
because this guy's always asking, what's the difference?
Yeah.
I'm always explaining to him like, okay, you know.
So I guess the argument could be it's not that you need to simplify them all. We just need to educate the population
Yeah.
a bit better, just
Yeah.
about general health, like health
Yeah.
literacy as a whole is.
Yep.
I find is very poor.
Yeah, it's another
Yep.
language.
Yeah, another language in general,
Yeah.
but people just don't know the body
Yeah.
as well as they should know their body.
Yeah.
Or just even looking at the most basic physical activity guidelines. Not
Yeah.
many people know that you should be moving at least 300 minutes across the week and doing
Yeah.
2 sessions of strength training. Not many people know that.
Yeah.
Yeah.
So if we can do a better job in maybe starting from schools,
Yeah.
so have a chat with Albo
Yeah.
or the health minister.
And the education minister. Alright, done.
Yeah.
My first goal will be
Yeah.
to speak to the education
Okay.
minister. Done.
Yeah.
Done.
So if you're listening to Lived and Told,
We should be.
that's
Yeah,
it.
yeah,
We'll tag you.
Educate them from a young age. 'Cause look,
Yeah.
did you guys? Because I grew up in New Zealand.
Mhm.
Do you guys have Healthy Harold, the giraffe?
Yes.
Giraffe, yes.
Yeah,
We had
so
Harold the
Kent to
giraffe.
primary
Yeah.
school.
Primary school,
In
yeah.
the kind of
At that inn.
dingy.
In the caravan.
In the
In
caravan.
the caravan. Very
Some-
dark caravan.
It was very dark.
Suspiciously dark.
And there was teaching us about not to do drugs and
Eating
exercise,
fruit.
eating fruit.
Eating fruit, that's really all I remember.
Yeah.
Yeah.
Literally
Healthy
say-
Harold
I
is
was
to eat an
gonna say-
apple and that's
Yeah.
about it.
Yeah.
I just remember.
You're like, cool.
That's
Thanks,
it.
man.
I just remember the puppet. That's all I
Yeah.
remember. Being like, oh my god,
The giraffe's talking.
The dark scared me. So most of the time I was just
Yeah.
like, why it's
I
so
know,
dark
right?
all the
Yeah.
time?
Yeah.
I'm scared of the dark.
So maybe we could change Healthy Harold.
turn the lights on.
Yeah.
First
Turn
and
the lights
foremost.
To the lights on and bring him from primary school. It's a high school. It's a high school.
Yeah.
Alright, done.
Yeah.
Alright, done. So
Just to give a different approach. I've actually seen on social media people saying that we should condense all our jobs into one title and call ourselves something like rehab specialists
Yeah.
or rehab professionals rather than having physio, osteo, myo, chiro. But I think that also comes down to training at uni as well. And not to toot my own horn, but from
Sounds
what
like a toot's coming.
I know.
yeah, a big toot's coming. From what I've heard, because I came into studying physio from New Zealand, so they transferred my New Zealand marks into ATAR. Does that
Yeah.
same thing?
Yeah.
ATAR, yeah.
ATAR. And from what I've been told, it's quite difficult to get into physio
Yeah. Yeah.
in Australia,
Yeah.
right? And I didn't know how hard it was going to be. So maybe for a lot of people who didn't quite get the ATAR to get into physio, they can still study something that we can still work with people without having to get like a 1 million ATAR.
Yeah.
You know?
Yeah, that makes sense.
Because to get into physio, well, especially when I was going through year 12, so what was that, 2015?
Whoa. God damn.
The ATAR.
Excuse me.
Excuse you.
the ATAR to get into physio, you had to get above 95.
Yeah.
So
right.
because it's such a popular degree, it's just saturated with people that want to do it. And most of the people that ended up getting into physio were people who wanted to get into medicine that didn't get the score from medicine, and that's usually the pathway they would go to then transfer into medicine. So the people that wanted to do physio couldn't because it got saturated with the med students who didn't get 99 but got 97.
It's like a double whammy of people that trickled down and, then, and people couldn't trickle up because they didn't get enough of an ATAR score to qualify.
Yeah, so the ATAR to get into physio was 95 my year, to get into osteo was 81. Just because no one knows what osteo is compared to physio. Everyone's like, I'm going to be a physio, I'm going to be a physio, I'm going to be a physio. And it's like, well, it's similar.
Yeah.
But
that's an idea for a new episode. Someone that works at a university.
Yeah.
Who says
who decides the ATAR?
Yeah, who says this ATAR?
But I think now that, especially over the last 10 years, the ATAR dropped for osteo. I think it got as low as 60 to get in.
60.
I think it's come back up again since probably in the last 5 years or so. But I think physios, you need to get at least a 90.
Yeah.
No matter what.
Wow.
And I used to work with with Crips as well, with Christina.
Yeah.
Sorry. And I can honestly say that the way we work is very similar. And I'm working with you now, Lisa, even though we're separate businesses, but we do a lot of work together. The way we go about our sessions are very similar. So in all honesty, it doesn't really matter who you go see, as long as you see someone who you click with and vibe with and who can get you to where you want to be and bridge the gap.
Yeah.
Which I guess comes back to, is the textbook better than clinical?
Yeah.
Depends who you see.
Yeah.
Exactly.
Yes.
Cool. So especially
if there's only one practitioner or title or whatever you want to call it, then obviously everyone has to get that ATAR and get into it. Yeah.
Become saturated again.
Yeah,
And-
yeah, exactly.
But then my argument is, wouldn't you want the best of the best to be those people that?
Yeah.
Oh, of course you would. Yeah.
So it sounds like the answer is no for that one.
No.
you would not want to combine your titles and your various.
Was it an answer or do we not have an answer?
Really?
We can discuss.
It's a discussion, but I think that's either.
I think we don't want you to be the health minister. I think that's what.
How dare you? How dare you? How dare you?
Yeah, very good questions.
We've had to pick one. Physio only.
Oh man!
What?
No? I
Not
know.
really.
I know. But I find you guys together. So you have to do lots of manual plus exercise.
Yeah, I
And
combine us and Cairo. All
Yeah,
three of
yeah,
us
yeah,
would
all
be
three.
combined.
Yeah.
And
Because when-
exercise is
But physio would be easier to...
Exercise phys doesn't do any hands on.
They can't touch. Legally, they can't.
They don't
treat.
touch anyone.
They can stretch,
I think.
but they can't treat.
But they can't treat.
Manipulate.
so they're really in between a minor and a physio. Then they're really right in between. Touch.
No, Mayo's treat.
Actually.
EP's kind of there. Oh, that's what I mean. It's very hard.
So I mean,
Yeah.
scrap them then. They're really combined. Just scrap them.
Yeah, I guess.
Did we answer that question? Did we answer
Yeah.
that
So
question?
I think the uniform answer was
No.
you would combine some, but not.
Yeah.
But not
And
really.
maybe not as drastic as I wanted to be like.
Like politicians.
Like Krippa said, the 16, for example. Let's say
Yeah.
the number 16. I was gonna go like 5, 4, like fucking. But she's probably more like maybe 10.
Yeah.
eight,
Yeah.
A more reasonable
It's got
number.
remedial for sure.
Oh.
I don't know what the point of a remedial is. Like, just
People that don't want to
true,
keep
true.
studying.
True. They don't want to diagnose or anything.
Yeah.
Let's just keep it as massage therapy,
Well, that's
and then maybe get rid of me, and just do physio, combining with Caro osteo. But call it physio because everyone is so universal.
Yeah, fair.
Sadly, because I love osteos as well.
Yeah.
But no one knows. Like,
But no one knows. Yeah,
that's why.
that's the thing.
60, that's a
Yeah.
ridiculously low ATAR. Ridiculously low.
I think it became really low because no one was
No one's doing it.
No one
no
knew.
one was graduating. No one was. No one wanted to go to uni. I don't know what the buy-in was.
Probably don't put it that preference.
Or the education. Suss it out with him.
Sorry, question
Take some later.
Yeah.
Alright, I'm going to speed off.
yeah.
Alright, ready? Question 3?
My
Yeah.
feelings.
Question 3. I think this one's a bit simpler. Question 3. Do social media therapists oversimplify rehab for engagement? An example that I see personally on my feed, I'm not sure about these guys, but I see people go, oh, do this one exercise, it'll bulletproof your back. Do this one exercise and you'll never, fall over again. Or do this one exercise and, your pecs will feel, you bench 200 kilos. Something ridiculous like that.
So are you talking more like allied health professionals doing this, or
Yes.
social media influencers? Doing
Allied
this.
health.
Allied
Allied health.
Yes.
Oversimplified? Yes.
Yes.
To be fair, you have to keep it simple, gen pop, right?
Yeah.
And it gets views. And people actually do it because it's so simple.
It's like a catch-22 because
Yeah.
yes, you get views, you get tons of engagement,
Mm,
but then people can take that and go,
Yeah.
I'm doing these 3 exercises.
why am I not getting better?
Why is my knee still cooking? It's like, right, you got like really bad
Everything.
whatever.
You got bad everything.
So yeah,
It is a- that's for sure.
But you kind of need to simplify
Yeah.
it. Like I said before, health literacy
Yeah.
is very, very low. But people take it very literally.
Yeah.
If I only do a cat cow, my arthritis is going to disappear. My posture is going to be
Yeah,
amazing.
it's not the time.
I know.
One review.
So it's really, it depends also how you word it.
Yeah,
If you're
that's
saying-
important.
Yeah, if you're saying to a cat cow, you're going to be
Mhm.
cured. You
Yeah.
can't really post that.
But they did
Against the
it.
APRA guidelines anyway,
Yeah.
so you can't legally post that.
But actually.
Yeah.
I don't know.
They have
It's
more
false.
strict. I think Austrians have pretty strict guidelines.
I don't know.
Yeah, well,
Okay,
APRA
yeah.
does. Yeah, whoever's
Yeah.
registered by APRA.
I'm not.
You're your own.
So you
You do what you want. You
Yeah,
do
I
what
do
you
what-
want.
yeah, I literally can.
Decompose cacaos will, fix all your arthritis in your lower back.
Yeah.
Oh, sorry.
So it needs to be simplified.
All right.
Because if you went too technical with it,
you lose people. And I've seen people get way too technical and they don't get any engagement and they wonder why. Because your content's boring. Because it's too technical. It's boring.
The Gen Pop's like, all right, I have pain. What's the quickest?
Yes.
Easiest path of least resistance, bro.
Yeah.
Everyone loves
And I suppose if you give them that quick fix and they're doing it, they're exercising, well, you've kind of won a little bit, right? Motion is lotion. So if you get them to move, I think that's a win. Yeah, okay.
So yes.
But they do,
So the answer is yes, I think, as a consensus. The answer is yes, but the caveat that it needs to be simple, these kinds of posts for the general population, or as Krippa said, those that aren't as literate, health educated or educated in allied health, for sure.
And you can include in the caption, you can go into a little bit more nuance in the caption, say, hey, cacaos are great, but unfortunately it doesn't fix all your problems. It's a good starting point.
Can help with this.
Book in to get a proper assessment.
That's the final.
Everyone's program is individualized.
Yes.
This is just lols.
This is just reviews. This is a question I just thought of now. Do you guys get that? Like, for example, you make a post about, maybe not one, but like 2 or 3 exercises that may help with X pain or X pathology or whatever it is. Do you guys then get messages saying, hey, is there what I can do? Like, they kind of ask for like kind of like free advice from you before they come see you, or not really?
Not that. No.
So you just don't reply.
Oh, so you do get it.
Yeah, there's sometimes people ask some really very specific questions to them. I'm like, bro, I'm not gonna assess you. You're in India.
From here,
Yeah. So if they're legit and they're based in Melbourne, then I'll get them to funnel them into the clinic.
Yeah.
Funnel's a very business word. Sorry.
You are a businessman.
Ask them. I would invite them for a session with myself.
Yeah. You kind of end the conversation then, be like, hey, I recommend you come see me in person and then go for your thing with me.
Yeah.
For sure.
It's very hard to advise them.
Yeah. You just print out the picture.
Yeah.
And then assess it.
Store it here.
Yeah.
Jumping. Have a attraction.
Sex.
Seems fine. It's fine.
Same thing.
Easy. Question 4. If I can read my handwriting. What does your profession need to stop doing immediately?
Whoa.
What do you mean by that?
So this is example. This conversation actually came from Adrian, who's on episode 2 of the podcast, and one thing he mentioned to me when we finished recording was about Physio saying there's this thing called dead glutes. I didn't really understand what that meant. So
glute amnesia.
What?
Glute, like when your glutes aren't active, so you gotta activate your glutes.
Turn them on.
Turn them on before you squat, before you run.
Right.
Yeah. So me, I'm general form. I don't have a background in allied health, but even me, I'm like, your glutes don't turn off. Like you're walking.
How did you walk here?
You're squatting. Going to the toilet, you're doing whatever. Like they're always on. So this question, so this question gives came from Adrian in terms of one thing that he's seen in his industry, which is obviously physio. And Dan, you might cover this as well. But what he saw in physiotherapy that people were posting that was not accurate and not true. So he would want them to stop doing that. So the questions open up.
Scaring, gay tactics.
Fear-mongering.
So for myotherapists in particular, or not anyone, but like your industry, myotherapy.
Whoever does that doesn't matter who you are. You should not do that ever.
What's fear-mongering?
Fear.
Like scaring you into.
The language is very negative. Oh, you're bad. You've got a really bad back.
You sleep on your tummy. You're gonna get neck cancer.
Yeah.
Like, like it's that extreme.
Yeah. Okay. Yeah.
I was gonna say, when I first started working as a new grad, I just graduated from uni, so I obviously learned a lot of medical language and jargon. Words like spondylolisthesis. Big scary words like that, which to us we spent 4 years learning at uni. So of course I'm gonna bring them everywhere just to show people that I'm educated. But then what happens is people go back home and they search online what you said.
Yeah.
And then on Google Images, probably not the best place to be looking at
Yeah,
things.
big cracks and red,
Yeah.
inflamed, and
Popping out.
lightning bolts. And
You are dying.
yeah.
So people, of course, have access to internet and all that. So
Yep.
I agree. I think fear-mongering people, but to be fair, some clinicians don't do it on purpose. This is probably something they've been taught.
Yep.
And they're also, I don't think anyone is trying to scare people on purpose.
Yeah.
So
But
they're not actively doing it.
Yeah, but they don't know that from the words that they use, that it's scaring the patient
Yeah.
to be scared about doing mundane everyday tasks. For example, bending.
Yeah.
Just like I had and it's so bad when it comes from a surgeon or a doctor because
Yeah.
people hold what they say as gospel.
Yeah.
So I had a surgeon at a spine surgeon tell a patient to not bend if they can, like use one of those picker
Oh,
up
the grabbies. Yeah.
to stop them from bending. And the surgeon said each time you don't bend, that's one extra bend you have in the bank.
What?
I'm like,
Are you serious?
Yes, I legit. But this is what the patient told me.
Yeah.
So there might be a
Say a
bit
lot
of,
with my face.
there might be some Chinese whispers going on.
Yeah.
Yeah.
In my case, I just call it whispers. But
Yeah.
anyway,
Not the whisperer.
Then actually the surgeon.
Yeah.
that's how I get people. But yeah, like stuff like that. And then,
Bank him up.
Yeah, bank 'em up.
What was your reaction then? Like, maybe speak to your with the client, obviously, but what was your initial reaction? Were you kind of like, whoa, or like, did you laugh, or like, what was your?
I think your face said it all. That was my face. That's only one of the few times that I've blatantly told someone that that's really, really false.
Yeah.
And then I went on to explain that your back is super robust and it's not like you have a finite amount of bends
No.
before you run out.
Just
Just wait, let me check how many
bends.
bends I've got. Yeah. So
Yeah,
that was one of the only times that I straight up told them that it's false. It's
Yeah.
harmful.
Yeah.
How do they digest that?
They listened.
Yeah, good.
Yeah, I never saw them after that, but they listened.
What?
You fix them.
What?
Unlimited bend. That's it.
Infinity bends.
I don't know why I had a flashback to the movie. I don't know if you guys seen it. The one with Justin Timberlake and how like they have time.
Yes.
Yeah.
In time, and they have like time. Basically, the concept is that. Basically, the concept is that money is pretty much eradicated from this society, and everything is stored in time. So you pay, for example, a meal in time, and time's stored on your hand, so you can see.
Nah, that's not for me.
Yeah, but anyway, that's about to
Yeah,
That's fine.
But when you said that, I'm like, oh my god, like a limited amount of time.
Yeah.
Or amount of I thought about that.
Yeah. So words are very powerful,
Yeah.
and we hold a lot of power. We don't know it. Not all of us do. Especially younger grads, they come out, they don't know that the words have a lot.
Yeah.
Yeah.
Anything to add to that? So, back to the
Say it
question.
again. Read it back to me.
What does your profession need to stop doing immediately?
My thing that I probably talk with patients about almost all the time is the posture chat.
Yep.
That everyone's like, people come in, especially like desk workers, and they're like, my posture's terrible.
Yeah.
And then I literally get them to look at me, and I'll be sitting like this, and I'm like, what are you talking about?
And they're like, wait a minute.
So my kind of take on it is, unless you're part of a royal family, there's not really such thing as like a perfect posture. Because even take the table.
What do you mean?
If we all sat like this,
Like this?
yeah, like sitting like this for 8 hours a day is not comfortable anyway.
Yeah.
Because we're not meant to sit like this for 8 hours a day.
Yeah.
So I think to kind of steer away from have perfect posture, it's more the conversation of get up, move around more.
Yeah.
And it's not get up, go for a run around the block. It's literally get up, bend, stretch, sit back down. No matter what way you get up and sit back down, you're not sitting back down in the exact same posture you were in when you were before.
Yeah.
That's my one.
Yeah.
Well, back when I was in
massive.
uni, posture was a huge thing. And that was like years ago though. So it was really important back
Yeah.
then. And then now there's so much research showing that it doesn't.
Yeah.
Really.
So I guess it's kind of that, like, if you go back to the last question, the clickbait, where it's like,
Yeah.
do you sit like this?
Yes.
How dare you? And it's like, it's okay. Like,
Yeah.
Look in the mirror, they're like, oh no.
yeah,
Yeah.
I'm a prawn.
I still get people that ask, "Oh, how should I sit?" I'm like,
How should I sit? Yeah.
"Oh, wow." People are still thinking that.
Well, how should I sleep?
Yeah, sleep.
Just
as
sleep.
well.
I'm a tummy sleeper.
Yeah.
And I
It's good.
advocate it.
Yeah.
And everyone's like,
Oh my god.
And I'm like, do you sleep on your stomach? They're like, yeah. I'm like, me too, fam. That's great.
Yeah.
Dad.
Do you sleep? Good.
I'm not rabbit holing here, but aren't there recommended guidelines on how to sit, how to sleep, how to drive, how to set up a desk? Aren't there recommended guidelines that people probably should generally be following?
Ergonomics and stuff. Yeah, but
I think it depending on like workplaces, they'll have pictures on the wall of how you should lift the box, how you should sit.
That kind of stuff's different.
Yeah. Okay.
Yeah.
Yeah.
As opposed to, there's no guideline of how we should be sitting right now.
Yeah, like look at us now. We're all sitting different,
very differently.
Yeah.
No, all very different.
Like there's no actual clinical guidelines on general posture.
I say not. You guys probably say this. Your best posture is your next posture.
Yeah.
I say that a lot.
That's the best saying.
Because people, and just to follow on that point, something else harmful that a lot of physios like to say is they go way too deep, rabbit holing down into the whole technique around lifting. Yeah. So if you take a deadlift, for example, they go way too into the specifics with technique. Yeah. And I think technique does have a time and place, but for the gym pop, I think just getting people lifting some weights, I think that's like, because a lot of times we scare people off if we go way too into the technique. They go, oh, this is too complicated. I'm not picking up a barbell ever again.
Yeah, touch your pelvis, lift your chest, bend your knees, lift your head up, lift it down. Don't breathe, hold your breath. And everyone's like, what? What are you talking about?
That was pretty good.
Felt like a rapper then.
You were!
That's the job of it.
Nash needs a beat.
Yeah.
Maybe the outro song for this episode.
That's the clickbait of this episode.
Yeah, that's it.
Alright, so it sounds like, as a consensus, what does your profession need to stop doing? It's around fear, it's around posture, it's around, really drilling down on things that have been proven to not be true, things that proven that, aren't that harmful.
It's not that deep.
Yeah.
Put it perfectly.
Just get up.
Yeah. Halfway through the questions. Do you want to take a break, guys? Quick break? Or
No,
keep trying? Alright, keep trying.
Good.
Alright, cool. This one here. If I can remember my handwriting. What do you... I should get on top. Anyways. How do you think, or what do you think I should say, could AI replace that you currently do?
That we currently
what
do.
would AI replace?
That we do.
Notes.
Yeah, notes.
Medical notes. Does that?
Maybe more like what benefit the client gets.
Oh, okay. Gotcha.
Yeah. So first, for context, I think I was on a webinar with someone that works at Microsoft, and AI, for context, is learning at a rapid rate. I think every 3 or 4 months, it's digesting even more and more and more, and everyone's life, if not already, has been impacted by AI sort of ways. So the question, back to the round table topic is, what would AI replace that you guys currently do that benefits the clients? Obviously, notes would be awesome for AI to do, but what's something that AI could replace? Or do you see replacing the next 5 years, we'll call it?
You guys have any that come to mind?
Maybe not that close. Yeah. Maybe not that close to the future. Like I was talking to my boss the other day, we were having the whole AI chat.
Yeah.
And she was saying at some point, like it maybe in hospitals, AI bots will be the triage people at the window. So someone will come, say all their symptoms, and then their own Dr. Google, pretty much.
Yeah.
So potentially, at some point, hopefully, AI scares me. Potentially that.
Yeah. I guess this question came, well, when I thought about this question, it was about with AI being so not readily available, one, but also two, there's a vast amount of knowledge it's already consumed. Yes. And that's just not ChatGPT, that's Grok, that's Gemini. What's to stop an average person from not seeing you and going, hey, I have pain in my left foot, I rolled it while playing basketball, these are the symptoms, this is how long it's been, and then you can probably give it exercises, talk it through the pain. That's one. That's where I guess the question came from.
I think unless it grows hands and feet, I think we're okay.
Yeah. I think it's the human connection of our job that keeps us in our job.
It's like the personality.
Yeah, because
brain.
Because a bot can be like, you've cooked your ankle, but the bot's not gonna be like,
you okay? Yeah.
Yes.
Yeah.
Well, you can tell
Oh, yeah.
ChatGPT to be very.
Yeah, you can tell it, be like, ask me if I'm okay. No.
Yeah.
Okay.
How are
Like,
your stress levels?
yeah.
Like, how's your mom?
Yeah.
Mm.
How's
Yeah.
everything else?
Yeah.
You can't see your swollen ankle
Yeah.
and see that it's purple and blue and you need a
Yeah.
tubey grip for the ankle, you know?
Yeah, okay.
And I also think that when someone comes and sees us face to face, and the fact that we go through the question asking, the subjective interview we call it,
Yep.
and then we merge into the objective interview, which is the objective assessment where we have them on the table,
Yep.
and we put our hands on their sore body part, have a poke and a prod, do some tests. That whole ceremonial process, I think, builds a lot of trust with the patient, and it helps them go, okay, this person's asked me all the questions, I've told them my story, and now they've physically touched my knee. They say I've got this problem. I'm going to trust it. I'm going to trust them more than me typing my Dr. Google. Even though you probably get similar answers. ChatGPT is pretty good. I've tried it for myself.
I mean, for acute pain with AI, maybe, but not like anything serious.
Not like chronic,
Yeah, okay.
I think if you're the type of person that's very objective and you don't really like talking to people, I think that might be able to work.
Yeah.
But it only gives you as much. The answers is only as good as your prompts. So if you're giving very vague, then they'll give you. They'll go from knee meniscus injury to knee cancer. It will cover everything, because I think AI needs to do that, right?
And people like to catastrophize. Because it's very easy to. So if they go from, oh, I could have torn my meniscus. Oh, right, I've got knee cancer. That's it. That's obviously what's wrong with me. I did sneeze earlier today. I'm sweating a little bit now. I've got cancer. Obviously. Like, that's how big the jump is. Because we've all done it.
You know, like,
we're not innocent. We've all done it.
Cold and flu. Oh no, I'm dying.
I should know like actual terms. Maybe you get a really good diagnosis.
Maybe it's spot on.
I don't know. Maybe.
But then I think you also need reassurance from an actual person, because then you'll go, even if you don't come to us, you'll go to your mum or your brother, your sister. You'll be like, says I've got knee cancer, and they're like, you're an idiot. And you're like, yeah, nah, fair.
Fair enough.
I think if they just took AI answers straight on, there's a lot of people with neck cancer.
Okay.
I think you touched on it perfectly. If it ever grows hands and feet, I think we'll be okay. People will still
so until then. Perfect.
It'll be sweet.
I think I read somewhere last year. I think you guys all say, because I think I read somewhere last year that I think ChatGPT in particular, I think they're gonna ban medical and legal advice.
Yeah,
I think
that's good.
I think they get
Good
sued.
for us.
I think they
good for us.
I think they get sued for it potentially, but I read that last
Yeah.
year, so I don't know when that's gonna take place or if it has taken place, or I'm not too up to date with it. But
Soon.
Yeah, like I've read somewhere that there's like people like, is my partner cheating on me? And based on what you've written, they'll be like, yes, and they're like, cool, I'm getting a divorce, and it's like,
it's a real thing.
That's real.
Yeah,
That's hectic.
and I'm like, see, this one, right? It's scary.
Oh, okay.
And then you go to your mum, I'm getting a divorce. You're an idiot. You know, it's
Yeah. Whoa, slow down.
Yeah.
It's not a simple yes or no answer. Yeah, okay. You touched on it there, Christina, before.
I mean, nuggets can you fit in your mouth?
I think you touched on it before, Christina, and this is a follow-up question actually. What will separate the good from the best clinicians, or even clinicians in general, will be communication over technical skills. So short way of asking that is, people in allied health will be valued for their communication, interpersonal skills over, per se, their knowledge and their clinical skills,
versus
communication.
So which one?
Wait,
outweighs?
Which one's better?
Which is better?
did not catch your question at all.
In the future,
Too many chips.
physios, we need more chips.
In the future,
Physios, so for your industry, they will be the ones that will survive will be the ones that have better communication / interpersonal skills over their technical clinical skills.
are you saying if we agree with that?
Yeah.
Oh, yeah. I agree.
Yeah.
Perfect.
Yeah,
100%.
communication kind of. You could be the best hands-on clinician ever, but if you can't, if you're a bot,
If you're an AI,
if you're an AI bot in human form, you can't make those connections with people. People don't trust you. They're like,
There's no rapport.
And I think everyone's had an experience where they've been to whether it's a GP, whoever, and they've given you absolutely nothing, and you're like, cool.
Sick. They heard none of that.
Yeah.
Here's some Panadol.
Yeah. And I don't know if you guys see it a lot, but it happens a lot more with female patients.
Yes.
Oh, really?
Yeah,
Yes.
like I had a lady, she's a bit older, like postmenopausal, and she had gone to see her GP to get some advice on how to manage it, and they literally drew a picture of someone doing a plank. They then proceeded to do a plank.
The stick figure thing?
Yeah, they then proceeded to do a plank and was like, do these and you should be fine. And I was like, are you serious?
Back pain?
No, like menopause symptoms, just menopause.
Just
symptoms.
do planks.
Just do planks, and your core will be better, so you'll start feeling better.
See, because one side will solve all your problems.
And I was like,
No glute bridges?
no glute bridges.
What the heck?
And I was like, you can't be serious. And it's just, he could technically be the best GP in the world.
Are you joking? Because that's not for real, right?
No, that's for real.
That's crazy.
How I managed to keep a straight face when she said this is beyond me.
Thanks.
Pinch yourself.
But like that's how ridiculous it can be.
Yeah.
So yeah, like I said, you can be the best hands-on, but if I'm coming in and telling you my uterus is about to explode and you say, "I'm just still plank,"
That would knit it back together.
Just some more sets.
Core work is important.
Yeah,
Number one.
core is key.
Just a
Number one.
They say if you're a 10 out of 10 knowledge person, but only a 4 out of 10 communicator, then you'll only be seen as a 4 out of 10.
Wow.
Yeah.
So work on your
Facts.
mic drop. But
Yeah.
I don't want to drop it.
Okay.
They say work on your communication big time, especially as a younger grad for anything.
Yeah.
The way you communicate, the way you make. Oh, there's another one I'll drop in there as well. Another quote. I'm a big quote guy.
Aristotle, relax.
Analogies as well.
Yeah. They say. What did they say?
What did Dan say?
What did they say, Dan?
They say people won't always remember what you tell them, but they will always remember how you make them feel.
Yeah, I love that.
Yeah.
And that's literally how I live in terms of my clinical life. That's how I live because it's so true. You can be so smart, but if you're crappy at communicating, you make them feel crap, they're going to walk out of there feeling
Even worse than when they came in.
Yeah. And I think so. It sounds like it's a uniform answer within each of you three. How did you guys develop your communication skills?
I wish someone taught us when we were just graduate or during our uni days.
Yeah.
Like,
did you guys not if you learned it, but more like obviously you're down the field for how many years you guys have been, definitely over 10 between the three of you. How did you guys develop your communication skills, the interpersonal skills? Did you have a mentor? Did you guys do like a webinar course? Did you guys just take notes on how you guys went and you got better over time?
I think for some people it comes natural. Like for me, I think it comes very naturally. Like I'm Greek, so I'll talk to a brick wall.
Give to the
gab. I've got the gift of the gab.
Yeah.
And I feel for a profession like we've got, you've got to have some of that already built into you to do well.
Yeah.
And it's something you learn, you get better at.
Yeah.
But you've already got it to start off with.
Have you seen new grads that come in and you kind of go, they don't really have it, they need to work on that? You kind of give them a nudge saying, hey, I think you maybe should,
Yeah, and I think most of that comes from a lack of confidence.
Yeah.
Because when you're fresh out of uni, you're kind of like, I know nothing.
Yeah.
Like I graduated in COVID.
Yeah.
So the whole last year of my course, we were online.
Yeah.
And our exams were delayed. We couldn't practice with each other for exams.
Yeah.
And I live with my granddad, so I wasn't snapping my 90-year-old granddad's neck at home to practice HVLA.
Yeah.
So I think, especially for my year level, when we graduated, we had a whole year and a half not actually
communicating,
talking to people.
Yeah.
So once we came out of it, our first years, I mean, I can only talk for myself, but it's very rough.
Terrifying,
Yeah, and then you got people coming and being like, what's wrong with me? And you're like, I don't know. I know, but I don't know how to tell you that I know.
Yeah.
But it's just exposure.
Yeah.
Getting
More
the
people
reps
we talk to.
Yeah. Just keep showing up.
Yeah.
I had to do mentoring because I just didn't know what to do.
Yeah.
I think webinars because during COVID I did webinars, and then eventually I found a Myo who did a course, and then I did her course, and it was so good.
Yeah.
Did they go through communication and
Yeah, how
all that?
important it was.
So
yeah.
good.
But it literally went down to confidence. If you're not confident, then you're not going to communicate very well to the person in front of you.
And they feed off that.
Yeah,
You kind of sit there and they'll be like, oh, my neck hurts. And you're like,
So does mine.
So does my brain actually hurts now after you've said that.
Yeah.
As opposed to being like, yeah, no problem. We'll try some stuff and get to the bottom of it. And they're just more receptive to it.
Yeah, okay. Did social media help grow that confidence as well? Like making content, does it help grow it or not really?
I only started doing it in the last 5 months.
For me personally, not really. I'm not a big fan of doing social media because I find it,
I don't think anyone.
for me, it's unnatural. Dan's very talented in the field. We collabed a few times.
We did.
We did.
Really?
You have to do it.
And it's a deep dive scroll.
I want to see.
But it's funny because people are like, oh, you're really good on camera, and I'm like, I don't like it. But in person, like I said, gift of the gab. I can talk to you for hours and hours and hours.
Talk to a big wall.
If anything, me on social media is a more guarded version of me.
Yeah.
It's hard to kind of be me when I've got a camera. Like we had photo day at work last week.
Yeah, I saw that.
And they were like, oh, be natural. And I'm like,
no.
They're like, maybe not that. And I'm like, I don't actually know.
Oh, maybe not her.
I don't know. Yeah, not her. She's in the back. She's in the back.
And the hair cut out.
So, for me personally, social media didn't help me.
Yeah, okay.
I feel the same.
Yeah.
Yeah, but it has great confidence in terms of not giving a crap.
Yeah.
Yeah.
It's confidence in the different areas. It's not confidence in terms of using your voice. I think someone that explained to me is like your voice is an instrument. So it's not honing your voice per se, but I guess maybe another area of aspect.
Yeah.
I like that, yeah.
Because I'm better one-on-one because there's no cameras.
Yeah.
And I'm comfortable with the person.
Yeah.
So I speak all day.
Yeah.
Well, can I say, just to toot your horn, is when you first started working here, you were very uncomfortable in front of camera.
Yeah.
But now, well, you still are, but I've seen your arc from beginning to now where you're now going, Dan, like, what do you reckon about this reel? And bouncing ideas off of me. And also
you hanging me off bands.
Yeah.
Bands to my legs.
I'm keen to see that.
So I've seen you go from where you were to now where you're probably still uncomfortable, but you can fake it till you make it, and you're doing it really well. Yeah, so good job. Keep showing up. Keep showing up. And for you, I haven't seen you post much, so no comment there.
It's progress for this year. It's goals for this year.
Done.
Yes, queen.
Done. Oh yeah, you then. What's been your personal experience coming out of? You obviously moved here. That's probably big shift in itself culturally, but then also since you started running your own business, like have you dealt with your interpersonal skills? How did you develop that, and how have you found it? On top of that, with the social media.
Yeah, I think social media is a great way to get yourself out there for many eyes to look at. Yeah. And unfortunately, I think in our game, and also in this current era of life, without social media, it's really hard to get lots of people to see. And having an Instagram account or Facebook, whatever you guys use, it's free. So it's such a great way to get yourself out there and for people to see, because people don't know what they don't know. So they don't know you exist. They don't know how to book. And at the end of the day, we've got to seek clients to get paid.
Yeah.
Right? So
to eat nuggets.
To eat nuggets. Absolutely. So social media for me, and Christina, you raise a good point. For me, it's an outlet. So for me, it's filling my cup, and I'm very comfortable. I don't know why. I just am. Yeah, I can't explain it.
Natural born star.
Yeah,
you are.
that's what I mean. You're born with it. You're born with it.
Yeah. Was that either have or you don't?
Yeah. Was that from day one? Almost. No, maybe not day zero per se, but after the first few posts, you're like, I enjoy this.
I enjoy. Yeah, I just like showcasing my life, and also I think from when iPods were a thing, I bought myself an iPod using all my pocket money so that I could vlog and document my life and make videos. Oh. So that for me has always been something I've really just loved doing. And now it's kind of become part of the job, part of the
100%.
Physio world.
Yeah. So if you want a physio, you'd be a video editor maybe, or?
Maybe, actually, I thought about this. I'd be in a wok. Sorry, not in a wok.
You'd be in a wok.
I would be
You'd be the wok. Yeah. You'd be the chicken in the wok.
It's getting late.
I would be a wok chef.
A wok chef.
Oh, really?
And I'd be filming. Yeah, I love cooking with a wok.
You'd be like a content creator, like full-time content creator.
I'd be creating content
Yeah.
in my walk.
In his walk.
There's a guy that does it already though.
Yeah.
Did you know?
Which one?
I'll show you afterwards.
He's a walk.
He's in the walk. I can't remember his name, but he's also Chinese. He's from Melbourne or Sydney, and yeah, he had
Dim sum Lu.
I don't know. I saw
Yeah,
him.
walk, Dan, walk.
I walked past a Dimmings and I saw like cookbook. I was like, oh, I recognize from Instagram, and yeah, he's famous for like, using his wok to make all these
Content.
dishes and whatnot. So I'll maybe look and see afterwards.
Link it to me, yeah.
Because Dan's very good at communicating. So where did you learn?
Where did I learn?
Yeah.
I think just from my years of working, you just pick up things along the way. Like we were talking about Mick Hughes before. Who, if you don't know who Mick Hughes is, he is a pioneer in the rehab world when it comes to ACL rehab.
Yep.
And I've attended some of his courses and just watching how he talks to patients, those little innuendos that he uses or little one-liners that just make sense.
Yep.
Like cues, some cues that just make sense with the patient. So you bank enough of these in your head and you just learn to pick it out in the right time.
Yeah.
And then that one cue may be really helpful for them, or that one quote may just resonate with them.
Yeah.
So it's just archived in the brain. You just have to pull out the right folder at the right time.
Yeah.
And just knowing your audience.
Yeah.
Yeah, if you're talking to a Gen Z versus a 85-year-old Margaret, your language is going to be very different, right?
Yeah.
Very different.
And your whole demeanor, I'm not going to be sitting like this with an 85
No.
about this.
Yeah.
Yeah.
Tell me more.
Tell me more.
Yeah.
Or not.
Yeah.
I didn't ask.
It's late.
It's like, alright.
We're having fun.
That's good. So I think that's that one there. I think it wasn't a yes or no question, but it's like, you've all had very different upbringings, but also very different paths in terms of gaining that confidence, gaining that voice, learning this interpersonal skills, and using your voice as an instrument for 85-year-old market or Gen Z TikTokers out there.
Yeah. And the fact that we're doing a podcast right now means that talking is more natural to us. Right?
Yeah.
So that
Thanks,
also
guys.
helps.
For volunteering / being voluntold.
It's alright.
Nuggets. Right with nuggets.
Voluntold.
Say less.
I'm there.
Alright, guys, you made it this far into the podcast. I think you'll be happy because I think these two, I'm proud of them. They're probably my spiciest questions. So thank you for making it all the way. I think maybe we'll do part 2 for this. Maybe we'll do part 2.
Yeah.
Alright.
More nuggets. Heck yeah.
Done. Alright, my second last question is, treatment plans are driven by business.
Give me some French fries.
So where I got this one from was you get treatment plan for X amount of weeks, X amount of months. I don't know if you guys see months, but definitely X amount of weeks. I think that sometimes clinicians take advantage of clients and extend that for longer than what it needs to be, and that's driven by their business because most of you guys are contractors or you sole traders. So that's my overarching statement that generally, and maybe this question talks more to the industry, not anyone in particular, but more to the whole industry, that the industry as a whole, you guys take advantage of clients sometimes. Not saying these three, definitely not these three, but that's my overarching
Can I
statement.
answer? Do you have anything you want to say first and foremost? I'll kick us off by saying I disagree.
You disagree?
I don't think that treatment plans are led by business, but I can see how it can be
For some
completely
people,
rorted
Yeah.
from a business perspective.
Yeah.
Because I'm not going to name specific disciplines, but I've known people who have come to see me and they've told me that they've gone to see Discipline A or Allied Health A
Twice a week.
and I'm
Times
like,
a week.
yeah, literally.
Three.
Buy a pack.
Yeah, buy a $2,000 pack up
Save
front.
$10.
Yeah. So then that does become very businessy and salesy. But I disagree in the sense that I think we don't print everyone out with a treatment plan and tell them what they need to do. But I can see where that makes sense because it gives the patient direction. Some people need to know, okay, this is my expectations and if it doesn't work, if it's too much, my expectation of the patient, and hopefully we've built enough rapport for them to be like, yo, I can't do once a week for 6 weeks. Yeah. I can, and I'm like, no worries. Let's do once a fortnight. Can you do that? And like, yep, I can do that. Yeah. So that communication comes back to communication. Yeah. But I think it gives people a clear outline of what the next couple months, because some injuries don't take 2 weeks to
Yeah.
fix. Some injury can take 6 months.
Yeah.
We know with tendons, that takes ages.
Yeah. So it depends on the injury they're coming in with.
Yeah.
If you know something like a facet sprain usually takes about 4 weeks, roughly. So you tell people the recovery period for what the injury is, and then be like, well, we recommend, highly recommend, if you want to get better sooner, this is what you should do. If you can't, we can modify it so it suits you. But if you want to get better quicker, do this. If it's okay, if it takes longer, cool, we can do that.
And I think that takes some confidence as well to be able to word that as a new grad, telling someone that your injury is most likely going to take 6 weeks or 4 weeks. You need to get enough reps in to be able to build that confidence to tell a patient that.
If anything, I've been the opposite. So like I assumed, I was told that I used to be biased. Obviously times are tough, and I used to not see them enough because I was biased. Like I would assume you couldn't not afford it. But it's expensive.
It is expensive.
Seeing us often, right? So I used to be the opposite. So now that was doing me also not good, and the patient not good as well. So now we can't be driven by either. It's
hard not to use your own biases. It's not. It's hard not to think about it from a their financial perspective.
I'll assume financially. I was assuming.
Because like if you take someone our age, what, in their 20s, and being like
20s.
late 20s for you guys, cost of living's brutal. But then you take a bloke that works a corporate job, you'd be like, okay, you can probably come a bit more often than the 20-year-old that's
What's the Woolies?
works at Woolies, doesn't do that. But if they're willing to come see you in the first place, well then you assume they're committed enough to get better. We'd like to hope so.
I think just open communication.
Mm.
And the setting there.
Working with them, not just by yourself.
Okay. So the short answer amongst these three is they don't do treatment plans just for their business. They do it for the benefit of the clients.
We're one of the good ones.
We're the nice ones.
But as the industry as a whole, not saying everyone, but they have seen instances where, unfortunately, when clients have been taken advantage of for
there's a
amount of
spectrum
reason.
to everything, and there's always bad apples and a bunch of good ones.
That's all right.
So we're all good apples.
We're the good ones.
The crispy ones.
Nice
not the
juicy
flowery,
ones.
not the flowery.
Nice juicy ones.
The juicy ones. Ready to go. All right. This is the last question I got for this episode. Hopefully it's a good one. But if people were...
Sorry. That's what you face.
It's just Dan's face.
It's the suspense. He's nervous.
His face.
If people weren't scared of pain anymore, think about that, right? If people weren't scared of pain anymore, there would be a big reduction in allied health, or there would be. So
people aren't scared of pain. So
yeah.
So they weren't afraid of pain. They didn't have pain.
They had pain, but they weren't scared of it anymore. They wouldn't need to go see allied health professionals.
Oh, it'd be finished.
That's the usual first driver of booking an appointment. It's pain, right?
Yeah, but they're not scared of it.
Pain. Okay.
Actually, no, it wouldn't be finished.
No, I don't think it'd be finished.
It'll be easier.
Yeah, I think
it'll be quicker.
Because people still come now and they're not scared of pain.
Yeah.
I feel more. Yeah, obviously people don't come because they're scared of it, which doesn't help our case.
Yeah.
But even people who aren't scared of pain just don't like living in pain, so they come. They just want to feel good. People just want to feel good at the end of the day.
Yeah.
Some people don't. Some people do. But I don't think if people weren't scared of pain, that's the end of us.
It'll be easier to rehab them.
Really?
No fear around pain.
Yeah.
So because the fear holds them back so much.
Yeah.
It takes so much longer to rewire that brain because they're just so
You've only got a limited number of bends left, you know?
Yeah.
Like that's what it is.
Damn, down to 27 now.
Yeah, 27 bends left.
And if you just zoned in on the podcast now,
Go
rewind.
back.
We don't have a limited number of beds. You fearmonger.
Are we done yet? I've got 2 left.
I ran out last week.
So how
do we recharge?
She doesn't.
Use my tongue.
Use his foot.
Chopsticks.
the little
His walk. His walk.
Scoops are everything.
I think because I've got current clients at the moment who they're rehabbing their ACL, and
Yeah.
they're not necessarily scared of pain.
Yeah.
But they know that they need to get stronger, and the only way to do that is to rehab and exercise.
Yeah.
So,
Well, I've dealt with more chronic pain clients, so lots of fear around that. So it's quite hard.
Yeah.
Yeah. Just kind of holding their hand a little bit, so they're not as scared. But it comes down to them and their stresses and stuff. So,
Yeah.
But definitely delays.
I think
feeling better.
Yeah, maybe people would probably come in a more active sense.
Yep.
They're not scared of pain. If you gave them a treatment plan, they'd be like, cool, I can do this, instead of being like,
I'm scared. Oh, it's gonna flare me up.
Maybe
It's
not.
gonna
Yeah.
Yeah.
So maybe more business.
maybe.
Yeah.
Don't
Yeah.
be scared.
It's
Don't be
opposite.
scared.
It's opposite. It's
Yeah.
opposite.
The opposite, yeah.
Yeah.
Have you guys had that in your experience where someone's come in and they're really hesitant to see you, but maybe through
They got forced.
a gentle
They got
nudge,
forced.
or forced? They're like, oh, I thought it would be super painful, but
Yeah.
obviously it turned out to be great
Yeah.
for them.
Plenty.
Have you guys had that?
Yeah,
Or-
plenty.
yeah.
They come in
Very
thinking
common.
they're gonna be like
Bashed or something?
bashed or something. I'm like, I'm not gonna hurt you.
Yeah, well, it's funny. There's the people that come in and they'll be like, I saw someone and they bruised me.
Yeah.
And I believe that you treat the way you like to be treated.
Mm.
So I'm a bit of a marshmallow. I'm very delicate
Yep.
when I
Yeah.
get treated. So I feel my approach is very
Yep.
marshmallowy.
Yeah, fair.
Whereas you'll get some people coming in and they're like, hurt me. And I'm like, well, you didn't come here for me to hurt you. You
Yeah.
came here for me to fix you. But
Yeah.
there's also this mentality, if it doesn't hurt, then I'm not getting better.
No pain,
And
no
it's
gain.
like,
yeah.
not really.
Yeah.
In some cases, maybe, but 90% of the time, that's not how it works.
Yeah.
Yeah.
Okay.
You came here to feel better, not to get bulldozed.
Yeah.
Not to limp out.
Yeah.
You
Yeah.
very much in agreement?
No, I agree with. I got nothing else more beneficial to add.
Yeah.
You guys have nailed it.
So I thought it wasn't as controversial, I thought, but I don't know.
Too mature.
No, she said we've got limited amount of bins.
Yeah.
Yeah.
Controversial.
Now I gotta pick things up with a what? Like,
A what? You are the what?
You know what?
Finger
I'm
what?
gonna get stick it. Grab
In the grabby stick.
then I'm gonna bank up my back.
My bad.
Oh, thanks, guys. Thanks for getting through all the questions. Can we do part 2 maybe? Want to take some more
Absolutely.
spicy questions?
Spicy.
Okay.
Alright,
I'm
done.
spicy.
To end off, we've been through some heavy topics today. Maybe we'll end off with some more lighthearted stuff. So maybe with a rapid fire question to end.
Yeah.
So first one is your favorite cartoon growing up.
Who's
Oh,
going first?
I need to think.
Alright, go, Lisa. Or Dan.
My one's Avatar: The Legend
Oh,
of Aang,
so good.
Yes.
and also Samurai Jack.
Yes, Samurai Jack.
That was my Saturday morning cartoons
underrated that one.
before my mom made me do that.
Cartoons.
Powerpuff Girls and or Ed and Eddie.
Really?
It's Cartoon Network, right?
Yeah,
Ed-
anything on Cartoon Network.
Ed and Eddie.
Or yeah.
Did you have cartoons in Greece?
I was born here. I was born cartoons. I watched SpongeBob.
Oh,
That's SpongeBob's alive. And I always watch The Simpsons.
Mm.
Simpsons at 6
Oh,
o'clock on Channel
Simpsons.
10.
Simpsons is pretty. Wait, as a kid,
like growing up.
it's pretty
Youth, infant, Angelina ballerina.
Yeah.
It's Ballerina. ABC Kids.
I was a ballerina for a year and then Mum pulled me out because that was terrible.
At least you knew. At least
Yeah.
you knew.
Thanks, Mum.
Favorite band?
Rock One Direction.
Really?
band.
And
I
I don't listen to.
Is Taylor Swift a band?
No.
No, she's a one-person band, I guess.
No.
No bands?
Would you say?
One Direction.
1D.
No
Wait, but they're no more. They've all.
Don't.
Oh, sorry.
Let's not talk about it. They're the best. Thank you, Dan.
I'll go. I'll chuck some K-pop, maybe some BTS.
BTS? Yes.
Or K-pop.
I was going to say, I thought that's where you were going with it.
Yeah, that's- yes.
Is Big Bang? Big Bang a band?
Big Bang's a song.
No, Big Bang is a K-pop.
Really?
Mm.
Oh, sorry. It's that correct. I think Big Bang's a song. Bang.
No.
Yes. Chat.
I did see Backstreet Boys live and they were elite.
Yeah, that'd be my
That was a proper
Yeah.
concert.
That'll be my answer.
Yeah.
Nick Carter.
Yeah.
You're on death row. What would your last meal be?
Spaghetti bolognese.
Oh my god.
Chicken nuggets.
From Macca's?
Yeah, from Macca's.
Where's 3?
What?
3 meals or just one?
No, one meal, but
This
she's
is
Why
my
she's
this is
three?
this is my no, but this is my meal. It's my train's coming out. This is just coming out of my trash.
It's one meal, but it gives us the
Oh,
Yeah, that's what's on my tray? Spaghetti
Alright,
bolognese,
so recap, sorry.
chicken spaghetti bolognese,
Yep.
chicken nuggets,
Yep.
steak with mushroom sauce,
Yep.
an M&M McFlurry,
Yep.
and a jar of Nutella. Oh, and a Coke. Full
Zero?
sugar Coke.
Zero.
Don't insult me with Coke. Zero. Full sugar Coke.
she's dying anyway.
You're
Give her
about
the
to
sugar.
die.
Exactly. I have a palette of a five. What's your favorite?
Filler spaghetti.
Yeah.
Was it banh mi?
It's the one.
What was I saying? Filler spaghetti.
Yeah.
Lasagna.
Yeah.
And dish. Bún bò.
Mm-hmm.
Yeah.
It's whatever you want.
Yeah, bún bò.
Yeah.
Everything.
And
What
my
drink would you
mum's
like?
dish called gantua, which is like a sweet and sour soup.
Yum.
What
Stunning.
What drink would you
Or
like?
drink.
Drink.
Water?
Yes, cold icy water.
Oh.
Sorry.
What?
Oh, I also want to add a chocolate big.
Chocolate again?
Yeah.
I love. Sorry, Sprite with ice. Has to be
Stunning.
cold
Yes.
Oh.
with water on
Yes.
the side.
Sugar or no sugar?
Sugar.
Sugar. Do you like sweet?
Yeah.
Give me diabetes.
Yes.
You know, no.
Dying anyway.
I'm just skinny while I'm there.
Go on, then.
Yeah.
Literally. You're literally
So,
Banh mi,
so they made it a
mapo tofu.
walk. All walk-based meals.
Walk-based meals only. I think what I would have, I would keep it simple. So my mum used to make this braised chicken dish.
Yes.
And it was just that and rice together. I could eat it for days. Just
What was it called? Was
it's
it?
just like a chicken braised.
Oh,
It's got
right.
potato, carrot, onion,
Oof.
and you,
Oh,
you
nice.
cook it for a long time, and it's so delicious. So
Lovely.
I'd have that and rice,
Mhm.
and then something I reckon. Just again speaking about my heritage, I go a plate of fried dumplings, like crispy.
Mm.
Like, you know what's in it?
And
What's in it?
yes, yes.
Pork and pies. Pork.
Yeah.
And for drink, I'll go a white monster.
Is that
I'm gonna
is
be
that
caffeinated.
what we're having?
White monster.
Two things.
Yeah.
What was
I so want to add. my grandmother's pasticcio, which is like Greek lasagna, and her galloped
Oh, Greek lasagna is so good.
I had that for the first time. The Greek lasagna. We were like,
You
last
need
year?
to add more to your last meal.
Can we share?
It's
No, this is
Is it
not
simple?
like
Is it
A closing tradition I have on the show, if you have this to the show, is I'll ask each guest here what's one piece of advice or what's the best advice they've ever received.
I already did on the first one.
Yeah, Lisa, we've done first.
What's your advice? Can you
Yeah,
sum
what
it
was
up?
yours?
Along the lines of fill up people's cups if they fill yours or something like that.
Oh, yes, that's good.
Nice,
Yeah.
nice. Stuff for people who don't feel it.
Yeah.
Yeah.
Do you have any advice?
I'm still thinking as you work in.
Okay, what's your life advice?
No one cares. Just do it.
Yeah.
No one
Amen,
cares.
sister.
No one cares.
Yeah.
Yeah, I see
Yeah.
influencers doing everything.
So
No one
that's
cares.
it.
Everyone just
Yeah.
walks past.
Yeah.
Yeah.
Oh, I love that.
Yeah.
No one cares.
Either mine says that no one cares more than yourself.
Yeah.
Yeah.
Yes. No one cares more
Yeah.
than yourself. That's it. That's probably the best one.
I would say the best advice, not really advice, but again, another quote.
Yeah.
And it goes something like this: trust is gained in droplets and lost in buckets.
Yes, that's a good one.
So
That's a good one.
Dang.
don't
Deep.
spilling any trust around here.
What's mine? I think mine is time heals all wounds.
No, that's great.
You've got to let time is your best friend and your enemy at the same time. You can't rush things. Things are gonna fall.
Yeah.
As they fall.
Trips
Just
will
let it
fall.
As my uncle Aristotle.
Aristotle.
We'll call him Aristotle.
Thanks, guys.
Thank you.
We'll do a part two.
Right.
We'll do a part two once I think of more spicier questions. Hoping there will be more spicier. Thank you for those who watched. Listened. If you made it this far, comment. Walk. Walk.
Comment, good word. Walk.
Comment. Walk in the comment section.
And banking back.
Banking back.
Banking your bed.
Thanks. All banks. Keep it short.
Banking bins.
Or bins even. Or bins. But yeah, walk. Comment walk in the comment section. And please support the podcast. Comment, like, share, subscribe. one last time, guys, where can anyone reach out to you guys if they want to come see you?
You can catch me at Osteo Krippa, KRIPPA, on Instagram, and you can see me at Alpha Sports Medicine in Newport or Baxmarch.
You can catch me on Instagram at Uncle Dan with 5 N's. I don't know why so many. And I'm the CEO of the Flexing Physio Clinic. Come see me.
He's the walk.
So I'm the walk master.
You can find me in Laverton at the Flexing Physio. It's at LisaMo_. Yes.
Cool. Thanks, guys.
Thanks to our host.
Thank you. Thanks, guys.
Well done.
Let's go.